Today, I will share some insight into why words matter and how environmental public health professionals can ensure their communication work, be it written or verbal, meets the specific needs and priorities of the populations they serve. Let's dive in. Why do words matter? Language in your communications should be non-stigmatizing and should reflect and speak to the needs of the people in your audience of focus. Here are some key principles to keep in mind. First, use a health equity lens when framing information about health disparities. This principle means examining the social determinants of health and understanding how they contribute to disparities. By addressing root causes, we can create more equitable and impactful communication. Furthermore, environmental public health programs, policies, and practices are more likely to succeed when they recognize and reflect the diversity of the community they are trying to reach. It is important to remember that health equity is intersectional. Intersectional means that individuals can belong to more than one group and might have overlapping health and social inequities, as well as overlapping strengths and assets. Understanding and accurately articulating the particular needs and experiences of your audience of focus can determine the level of impact, success, or failure of an intervention. Second, use person-first language and avoid unintentional blaming. Putting the person before their condition or circumstance helps to humanize individuals and avoids perpetuating stereotypes. This approach fosters empathy and respect, promoting a more inclusive dialogue. For instance, instead of using phrases such as underserved people or underserved communities, the underserved, hard to reach populations, or the uninsured, we recommend using the following phrases. People who are underserved by, and then you would list a specific service or resource. People who are underserved by mental health or behavioral health resources. People who are medically underserved, or people who are uninsured, people who are underinsured, or people who do not have health insurance. A more detailed list developed by the Centers for Disease Control and Prevention can be found in the resource section of this module. So third, you should use preferred terms for select population groups while recognizing that there is not always agreement on these terms. It is important to respect and use language that communities identify with. By honoring their preferred language, you can establish trust and better engage with diverse communities. Do not be afraid to ask individuals or groups what terms they prefer. Asking demonstrates your respect and desire to genuinely engage with that individual or group. Fourth, consider how communications are developed and look for ways to develop more inclusive health communication products. This developmental process involves including diverse voices and perspectives. By actively seeking input and collaboration, you can ensure your messages are relevant, accessible, and representative of the communities you serve. Also, insufficient consideration of culture in developing communication materials can unintentionally result in misinformation, errors, confusion, or a loss of credibility. If possible, ask the groups you are targeting in your communication to review your text and images to make sure you are representing them in a thoughtful and respectful manner. Finally, explore the resources and references related to health equity communication. Staying informed and seeking out additional guidance helps you stay current and responsive to evolving language and cultural norms. As we know, language, cultural norms, and preferences are constantly evolving. By continuously learning and adapting, you can improve the effectiveness of your communication strategies. All environmental public health professionals at the federal, state, and local levels should look for opportunities to apply these principles across their communication work. These opportunities include when you create information resources, such as scientific publications and public health recommendations, or when you engage with communities, partners, and staff. Using a health equity lens in communication planning, development, and dissemination means intentionally looking at the potential positive and negative impacts of the proposed message on everyone. Your communication should be inclusive and should avoid bias and stigmatization. The goal of your communication should be to effectively reach your intended audience. And you should create your communications with input from those intended audiences. By prioritizing equity and inclusivity, you can bridge communication gaps and create a lasting effect on the health and environment of the communities you serve.